Good morning. My name's Courtney Coursey. I work at Emory University Hospital in Atlanta, Georgia. I'm a radiologist and I specialize in abdominal imaging. I'll be discussing an article that I was a co-author on that was published in the February 2010 issue of the journal Radiology. So as part of this study, we looked at the patients who had undergone an appendectomy for acute appendicitis at Duke University Medical Center from 1997 to 2008. And we looked at the number of patients that had undergone a CT scan prior to appendectomy. Now, back in 1997, about 19% of patients had a CT before the appendectomy. But over the years, that number steadily increased, and by 2008, 93% of patients had a CT prior to appendectomy. Okay, so it's been known for many years in the surgical literature, especially before the CT era, that women of reproductive age had an especially high negative appendectomy rate. The main reason for that is that women have a number of causes or potential causes of abdominal pain, such as pain related to the ovaries or fallopian tubes that could potentially confound the diagnosis of acute appendicitis. So with that in mind, we wanted to look and see which patient groups, if any, especially benefited from this increased use of preoperative CT. So we divided patients into males and females, and then divided those groups into patients of reproductive age, which we defined as less than or equal to 45 years of age, and then those patients older than 45 years of age. And so we found that when we looked at the negative appendectomy rates, that women less than or equal to 45 years of age had a significant decrease in the rate of negative appendectomy as the rate of CT use increased. Specifically, back in 1997, of those patients of the female patients of reproductive age that underwent an appendectomy for suspected acute appendicitis, 43% had negative or normal appendices at surgery. But we found that over the course of time, as CT use increased, the number of normal appendices that were found at surgery steadily decreased, such that by 2008, the number of women of reproductive age who underwent an appendectomy that were found to have a normal appendix was down to 7%. So that was a significant decline in the number of negative appendectomies in women of reproductive age. Now, for the male patients that were less than or equal to 45, we didn't find that. It was somewhat surprising, but as the percentage of patients who underwent CT increased, the negative appendectomy rate didn't really change. It started out in 1997 around 10%, and it fluctuated slightly around 10% or less over the decade of the study, but there was no trend towards a lower negative appendectomy rate with increased use of CT. And then for the men and women that were greater than 45 years of age, to be honest, we probably didn't have enough patients in those categories for each year to really draw strong conclusions for those patients. So for some of the patient categories for a given year, early in the decade, the negative appendectomy rate was 0, and we didn't, perhaps because we had small numbers of patients, we didn't detect a change in that very low negative appendectomy rate for those categories of patients. Okay, I think it's a challenging question. I know as radiologists, we're definitely very aware of the risk of radiation. And with each of our CT scans, we do all that we can to try to make that risk or the radiation dose as low as is reasonably achievable. We can do that by changing the settings on the CT machine to keep that dose low, by limiting our scans to just the area of interest. Also, sometimes we can use bismuth shielding to shield areas that are part of the scan that may be at risk, especially to radiation exposure. So it's definitely a concern. And the main article that's often cited is the New England Journal article that came out in 2007 and by Brenner et al. And that article said that for an average 25-year-old patient who underwent a CT of the abdomen and pelvis with the usual settings, the estimated attributable lifetime risk of death from cancer was 0.05 to 0.06%. So that's a young person, so potentially a more at-risk person as compared to an older patient like an 80-year-old patient. And that's the risk that was cited. Now, you just have to weigh that risk with the risk of death. If you have appendicitis, it's not diagnosed, and your appendix perforates. And there have been a number of articles in the surgical literature looking at that scenario, and the risk of death from perforated appendicitis has been found to be as high as 2%. So there definitely is a risk of radiation with the CT, but you just have to weigh that risk with the risk of either missing the diagnosis and going on to have a perforated appendix with all the complications that that would entail, or the risk of having unnecessary surgery if your appendix is normal. And so I think we should all think about the risk of radiation whenever we order or perform a CT scan as physicians, but I think you just have to look at the individual patient and weigh the risks and benefits of doing the CT versus missing or making a given diagnosis for a given patient. Let's see, so in our study we didn't specifically look at pediatric patients, and so I mentioned before that as radiologists in general, we're all concerned about radiation, and I think the subgroup of radiologists that practice and subspecialize in pediatric radiology are especially concerned with radiation for the reasons that you mentioned, including the just longer lifespans of these young patients. And so the workup of appendicitis in pediatric patients at centers that have pediatric radiologists, usually it starts with ultrasound because ultrasound is completely safe, doesn't have any radiation involved. And so that is a difference in the pediatric community. The reason that ultrasound isn't used so much in adults is because ultrasound is very operator dependent. And also, for those of you who have not had an ultrasound before, the way it works is the sonographer or the physician places a transducer on the patient's skin, and that transducer can only penetrate a given number of centimeters and can only see a given number of centimeters deep into the patient. And so you can imagine if you have a small child and you can see in several centimeters, you could see a lot in that patient. But once we start talking about adults, and especially large adults, really ultrasound just doesn't give us enough visibility to see the appendix. So that's why ultrasound, at least in the United States, is not really used frequently to evaluate acute appendicitis for adults at most centers, but it is used quite frequently for pediatric patients, especially in places that have pediatric radiologists.